Greta.
Thank you and good morning. Thank you for the opportunity and the invitation to appear today. I speak to you from my home near Winnipeg, Manitoba, and I acknowledge that I'm on Treaty 1 territory, the traditional lands of the Anishinaabe, the Cree, the Oji-Cree, the Dakota and Dene peoples, and the homeland of the Métis Nation. I'm a registered nurse, and I have spent my entire career in the community, most of it in public health. But I'm here today as the president of the Canadian Nurses Association. There are more than 431,000 regulated nurses in Canada, the largest group of healthcare providers across our health systems. The Canadian Nursing Association is the national and global professional voice of Canadian nursing, and we represent 135,000 members, including licensed practical nurses, registered psychiatric nurses, nurse practitioners, and registered nurses. And in the past few months, the impact of the coronavirus on our country, on our work, our economy, and on our lives has been far-reaching and staggering, and the health and safety of the people and the nation's healthcare workers are uppermost in all of our minds. The Canadian Nurses Association certainly appreciates the measures taken by all levels of government to minimize the spread, to respond to the pandemic and anticipate our recovery. And we've benefited from the leadership of our public health officers across Canada. We're supportive of the strong communication from the Chief Public Health Officer, Dr. Theresa Tam, and her team. And we've had good communication with Health Canada, including the Minister of Health, and we thank them all. But I'm going to highlight very quickly 8 key areas that we keep hearing from nurses. First of all, 3 months into the pandemic, the consistent, reliable, and adequate supply of personal protective equipment remains an issue. Decisions about the use of PPE must be driven by evidence, not availability or fear of shortages. Healthcare workers need clear guidance for their use of this equipment and access to it. Secondly, disseminating consistent information and guidance is a challenge in a federation across thousands of employers in many sectors of healthcare. This requires greater collaboration to reduce confusion caused by different guidelines and directives across jurisdictions and practice settings. Third, the World Health Organization is urging large-scale testing, but Canada falls behind other nations. Nurses are concerned that without this data to contribute to public health surveillance, prevention, further mitigation, and recovery efforts will not be evidence-informed. Fourth, prior to COVID-19, nurses were reporting high levels of fatigue. Nurses now face significant challenges to their mental and emotional well-being. Rapid access to tailored, no-cost mental health supports needs to be here in the pandemic and long after. Fifth, we are working with CNA, the Canadian Medical Association, and the Canadian Institute of Health Information to determine the impact of COVID on the health of healthcare workers. But we need to know who they are and where they are. So we urge governments to fund systems to track this most important data. This is a long-standing issue. 6, nurses worry about populations who are at higher risk of COVID-19, including Indigenous peoples. Other vulnerable populations include those who are homeless, those who are in congregate settings like prisons and shelters, and these populations require strategic and ongoing supports. 7, given the lessons of history, we urge an evidence-informed and cautious reopening of services across society. We're concerned that the virus is still very much alive, still spreading, and not well understood. And finally, to the issue of long-term care. The pandemic has laid bare the crippling lack of standardization, funding, leadership, appropriate staffing, proper training and equipping of the people who deliver services in our long-term care sectors. These vulnerabilities are well documented. We must reimagine aging in this country, including support at home, institutional long-term care, and end-of-life care, and put in place the bold changes that are needed. We meet today in the Global Year of the Nurse and the Midwife, and nurses across the country have answered the call of this pandemic very ably. And on behalf of Nurses of Canada, I ask you to place nurses in leading roles in the analyses of COVID-19 response that lie ahead. Listen to them, bring them to the table, and know that they and we will deliver the best evidence to help governments and health system decision makers reimagine and develop systems and implement the required change. Thank you.